Good morning, all. This is Dr. Sue. It is Sunday morning in June, and I wanted to talk a little bit about urinary tract infections in children. The first audio is going to be discussing diagnosis. The second audio I'm going to do is going to be discussing treatment and management. So for the first concept I wanted to mention is that urinary tract infections are unfortunately common in little girls. Little boys rarely get urinary tract infections. Now, when little boys are at risk, it is when they are uncircumcised up to the age of 6 months, and if they have fevers, prolonged fevers of unknown etiology without other symptoms, is when we start to look at urinary tract infections in boys. Although boys don't generally get UTIs, they can. There's always those outliers, so typically, if a little boy is having, and when I mean little, I mean throughout the span of, from 0 to 18, what we do is we will definitely check the urine to make sure that there is nothing going on. I have to say, out of my years of being a physician, I have only seen a urinary tract infection in males, uncircumcised males, twice. So we always do check the urine just in case there's anything else we're missing, particularly in the adolescent and young adult world. STDs can present as UTIs as well. So we generally always check that urine when we can and go from there. So now that you know that generally it's little girls that get UTIs, the things that can cause UTIs are pretty surprising to many. First off, I wanted to mention urinary tract infections can happen because of abnormalities in the urinary system or the kidney system. You will see, generally you'll see fevers, you'll see, if they're old enough to tell you, painful urination. You may see red urine, blood-stained urine, and smelly urine. You may see that as well. Now, generally, when there is an abnormality in the urinary or the kidney system, we'll see fevers quite young, and these will be high fevers in little ones without other symptoms. Fevers without other symptoms that are prolonged, 3 to 4 days, that kind of tips me off to saying, could this be a urinary tract infection in this little one? And that's when we'll check the urine and make sure we don't miss that. Many times I have seen this occur in infants where there is an abnormality such as reflux. You can see reflux back from the ureters into the kidneys or from the urethra into the bladder, and all of that creates a condition where bacteria can grow. So that is something that always comes to mind with prolonged fevers. The other things that can cause fevers in little ones, surprisingly, is constipation. And that's something that I had discussed in my audios and my videos last week. And I briefly mentioned that urinary tract infections can be caused from constipation, but it truly can be an entity. In fact, I have a little one that I'm working with closely because constipation created this as an infant. So she had testing. Everything was perfectly normal with her urinary tract, her kidneys, everything was great, and constipation was the key. So now that we're managing her constipation, I can't tell you the last time we've had a urinary tract infection with her. Remember, constipation is hard stools. It's kids that can go without stooling, and if they have some, it can be small hard poops, and then they can get liquid around those poops too. So constipation is generally something that parents typically have a clue into, and then they let us know as pediatricians, and we go from there. So making sure you address the constipation. Please, if you need a refresher, please make sure you go back to those audios about constipation, because there is some great information that I provided in there that I won't be able to provide in this discussion. But please do review that if you feel like that might be helpful. One of the other issues, other than abnormalities in the urinary tract and constipation, one of the other things that can cause urinary tract infections in little girls particularly, is vaginitis and inflammation caused by things such as bathing in bubble soap, staying in a wet bathing suit all day, letting it get wet and then dry, wet and then dry. All of those situations cause irritation and leave them at risk for bacteria growth. So significant vaginitis can present as symptoms of a urinary tract infection, where the little one, if they're old enough, will tell you that they're having pain with peeing, and you'll think, okay, what's going on here? If we take a look into that vaginal region and there's no fevers, no other symptoms that we're really concerned with, then generally vaginitis is the key for us to manage. Little ones get inflamed at their vaginal regions from so many things. Everything that's fragranced, fragrance soaps, fragrance detergents, even, it's crazy, but some diapers are fragranced as well. So if you have a little girl, I would start to get used to staying away from bubbles, staying away from the things that are bubble soap and very fun in the tub, unfortunately, but keeping them with just water, bathing them in the water. Epsom salt, I love Epsom salt too. I often tell my families about putting a little bit of Epsom salt that's unscented in the water is great too. It's a great cleanser, and it's a great, it's healing. Salt is very healing. So I love Epsom salt. But making sure that if you do use the soap, and when they're older, and when they're older, they do get dirty. So you do want to use some kind of soap product, a gentle soap product. But what you can do is have them sit in the tub, play with their toys, and then have them stand up, use the washcloth or the loofah, soap them up, wash their hair, and then rinse them off while they're standing up using the shower. That's a good way to keep that soap from irritating their bottoms. So I think really those are the main issues with urinary tract infections I wanted to speak of. If there's a family history of urinary tract abnormalities or kidney issues, that's always a good tip off too, if there is something with regard to a urinary tract infection going on. If a little one gets a urinary tract infection once, typically I let that go. And I say, okay, you're allowed to have one before we go through the workup. If they get a second, then that's something that I like to pursue more of a workup for. I don't want to miss anything. I want to make sure we know what's going on with those kidneys and the urinary tract, and make sure that we can prevent urinary tract infections as much as possible. We do want to make sure we do that. If constipation is the issue, oftentimes we will talk about going to a GI specialist to make sure there's nothing going on with that colon, figuring out how to best manage that together, particularly focusing on diet as well is key, and making sure that we do that. And I did mention a little bit earlier, excuse me, that for adolescents and young adults, symptoms of urinary tract infection can also be related to STDs. So for your older kids or your young adults, always encourage them to be seen with regard to symptoms such as this. Young adults and teenagers that are having sexual intercourse, they are very much at risk of urinary tract infections. What you want to do is make sure that they need to urinate after having sexual intercourse, making sure that they clear all that bacteria out from their system, from their urethra, so that it doesn't turn into an infection. Those are things that I can talk about with my adolescents and my young adults, so they know better on how to prevent things like that. And the same goes for them too, making sure they're not using the fragrant soaps, making sure that they're not sitting in a wet bathing suit all day and just kind of going in and out of the pool. That when you get out of the pool, change into dry clothes. When you want to go back in, you can change back into that bathing suit. So those are things for the young men. What I do is I always check the urine for them too. And through the urine, what's great is we can test for chlamydia and gonorrhea as well. Those are symptoms that can present the same way with painful urination in males as well. So I live by the Niagara Falls Airport, so there is an airplane going by. I'm so sorry about that. But in Lewiston, we are right in the flight path. So those are the kind of things that I'll talk about with young adults and our adolescents that may be having frequent UTIs without true etiology that we can't figure out otherwise. So anyway, I'm going to talk about management and treatment of urinary tract infections in my next audio. I hope this is helpful, and thank you so much for tuning into these videos. I hope that my experiences are able to provide our families who decide to listen to these audios and videos some support as they're trying to manage their children and optimize the health and wellness of their own kids. Thank you so much, you guys. Stay tuned for my other audio coming up next.